and connect the tube, it will definitely flow. And in spite of all these things, if it is not flowing, you can try using a Y-port system for transfusion. Mix it with saline and another container, another bottle, and you can transfuse it to the patient.
Yes. And issue not required is one. I think if you really need the blood, if you anticipate that the patient needs, and you can always get it cross-matched and then immediately the blood bank. And if we are working in the same hospital, the blood bank is very near, you can easily, I think, take it while there is a very
such problems wherein the blood is taken and it is not used, and the patient requested, since there was not much blood loss in this particular surgery, so would you take the blood back to the blood bank. So the rule is that we cannot access the blood that is once issued out of the blood bank, because we don't know what happens. We have confidence in the clinicians, but we don't know what happens during the transport time, and anything could really take place. So it's ideally, according to drug controller, which they are not supposed to accept the blood that is once issued out of the blood bank. So instead of wasting the unit simply getting issued and keeping it and not using it, it is ideal that you reserve the blood in the blood bank and take it only at a time of requirement. So even this reserving of blood has so many problems with the blood bank management, because most of the clinicians reserve the blood for their patients and not take it. The cross-matching is done and they do not take it because it is not required. But a request from the blood bank people to the clinicians is that if it is not required, kindly inform back to the blood bank so that that particular unit could be used up for some other patient. It is kept reserved in the name of that particular patient, so it could be used for some other needy patient. So informing back to the blood bank is very important.
Any other questions?
Apart from these additional questions,
I have a particular question. I know the answer for it, but there are many senior doctors here. I would like to take their opinion also. Actually, in Gulbarga, when I asked for a blood transfusion, the patient, I don't know where the blood bank brings, and it is already 4 or 5 hours, sometimes 8 hours, he brings me to the blood. And it has taken a lot of pain to bring that blood. And I know I should not give it, but that is the only blood he has brought. And if you don't give it, we may not bring the other. And in such scenarios, we are compelled to give that. So is there any alternative and what?
Yes, as we said, instead of asking the patient to get the blood and they travel for a long distance and then
All measures we have taken. After that, they have come with 6 to 8 hours blood. And many other instances, I have been compelled to give it. I accept it. And many of the times, the patient did not have any reaction. So I want to know if any other practitioners are compelled to do so and any observe any reaction, or everyone also sincerely.
it is lucky that the patient didn't have any reaction. So you are lucky that the patient has gone, they have felt that they get the trouble to get. But ideally, try and avoid such situations where it takes a lot of time from issue to transfusion. That transit period should be reduced. So when required, when you decide to transfuse, only at that time ask the patient to get the blood.
After that, 100% sincere effort is happening.
Yeah, in that case, you would go in for a refrigerator, which is blood-bound refrigerator, which has specifications which could be maintained, and you can get the blood and store it in that particular
Transport that might recommend.
transport. Yes, we discussed about the containers, that is cold containers which could be used, but the blood banks should be having that, and since it is expensive, I don't think many blood banks will issue the blood bank in a transport container.
So container transport is not feasible, practically not possible. At least pack
Ice packs would be used instead and transported. That is one remedy for blood which would take a long time to reach the patient.
And I just want to say, blood bank, we are there for the patients, but it takes some time, after we bleed the donor to prepare. There is so much of pressure on the technicians and the blood bank officers for that. And we are not supposed to do a spot test for detecting this antibodies to transfusion disease. So it really takes us some time to screen the blood and prepare the blood products and give it to the patient. That is why I think we keep fighting with the clinicians.
And all of us know that blood can be obtained only from humans, so it is not available readily. most of the patients, especially, they think that it is our right to take the blood from the blood bank, and if it is not issued on time, they even go to create a lot of problems in the blood bank. So this should not happen. So everybody should realize that it is not readily available in banks and it can be connected directly to the patient. So this requires a lot of motivation among the patient, among the general public also to come forward to donate blood. So the availability of the blood in the blood bank is also very important. So for this we need to go for frequent camps, and in the general public it is extremely difficult to create awareness, though nowadays it is really better than what it was before. So compared to blood donation camps conducted at colleges, wherein we get more than 100 units of blood in a single camp, when we go in for a general public blood donation camp, it will be just 10 or 15 units, or sometimes even 3 or 4 units. So it is that difficult to motivate the general public. So
please help any blood bank, your blood bank to conduct a lot of blood donation camps, because you're with the public. Of course, there should be a lot of socialization of blood bank people also, but that is one. And whatever it is, with component separation, we are able to provide the necessary components to patients. A lot of plasma. Plasma is not being used at all, and this plasma is not wasted, so we are just sending it to Reliance for their site, for their research or whatever. Most of the blood banks are sending kgs of this plasma to Reliance, because plasma utility is not so much. It is the red cells which rank, the vaccines which rank number one in the requirement.
it is not only the responsibility of the blood bank to provide the blood at the right time, some responsibility also lies with in every citizen who knows about blood donation. So as Madam said, there was a clinician in our hospital who would ask the patient's attenders to give the replacement blood, but they would be hesitant. So he would come forward to donate blood and show that nothing would happen if I donate, so you can also donate. So it is not that everybody should come forward to donate, but this is just like there is some responsibility on our part also to educate the patient that blood donation is possible by all of us. Every one of us can donate blood, so that there is no scarcity.
Yeah, our clinicians are very happy. They support it, especially the IND department, I should say. So they're happy that talk about you encouraging words to us in the blood bank. We do more, lot of work and all that. And so your support, and so it is a coordination between both the departments that needs to be there to provide whatever is needed, so the right component to the right person at the right time. So we are with you, I just want to say, to provide the best whatever is possible. And I think SDP is one probably you also need to look at.
Just would like to answer Doctor's question. Today the scenario in Gulbarga has changed. Very rightly said, previously the blood banks were far and few in Gulbarga. Most of the surgical procedures, people used to advise the patients related to get blood from Shashikala.P, which is about 100 kilometers from here, and the transport mode is train only. So it used to take about 6 to 8 hours for the blood to reach. And when the relatives saw that things, they used to insist, we have taken all that over, why don't you give? So 20 years back, when we started practice, the senior was that we used to transfuse, and luckily, probably most of the patients will agree we had very few reactions. Now my second question, or my second thought question is whether the blood is issued and not used, and the scenario will be returning to the blood bank, can the blood bank authorities think of separating only plasma instead of wasting the precious commodity blood and give it to the needy people? Because the bottle has been issued, we cannot retransfer the blood to any other person, but can we think of now removing plasma, which is can be freeze and dried and kept? There are some sort of things. This is just thought for the further research.
So that is already done before issuing. So the components are issued, the plasma is already separated, and in case of whole blood.
No. Today few of the surgeons still want whole blood. We are dealing with the echo because of the loss of blood, where we would like to replace the whole component instead of components, 3 components. One bottle should give all the components. So we prefer whole blood in polypropyl cases. So in that instance, suppose we use 4 units and 15 minutes reserve, we have to return it to the blood bank. So when they return that unit to the blood bank, can the blood bank think of separating components which are not going to be destroyed by the storage in the ward or in the OT and reused to use in some other patients, like plasma, field like plasma. Separate it out because the components, the RBCs, WBCs, I know they will be degraded, they will be RBCs will be destroyed, hemolysis will happen, but still plasma can be separated. This is a point for further analysis.
So, that's a great idea, but everything is documented in the blood bank. So, if we show to the blood drug controller that there is one plasma extra, so we have shown that as being issued to the patient. So, we need to show it as one extra donation. So, there is a discrepancy in our calculation or amount. Second is, we don't know what would have happened to that blood during the transit period and during the storage. So, if probably somebody doesn't like Zenith, I'm just lightly and tell you, they would have injected something into the plasma and we don't know. So, we just don't want to take that risk. So, we believe the clinician, yes. But you have not taken it directly from the blood bank, you have not monitored it for 4 or 5 years. There are a lot of hands through which this has been transferred or it has reached. So that is the problem, and we make that account for the drug controller. Otherwise, that's definitely instead of wasting, as you say, the plasma.
Later on, regulations can come, but if you try on these trials, we can tell you the authority that instead of, see, after all, we have to return the bag to the blood bank for disposal. We cannot dispose it in the nursing home from there.
Yeah.
So we have to send it to the blood bank, proper disposal. So then we can show an extra bag. These things can be thought of.
That would be definitely thought of. So instead of just discarding, throwing, wasting, so what else would be done? We just think of, but not to transpose it to another patient. But probably at the research purpose. Madam, I don't know what she says, Dr. Langapile. That blood would be used for any other research or your experiments, but not mind to Dr. Langapile. Again.
Blood is a drug, considered as a drug. So what happens after going from our blood bank, what temperature it is kept or we don't know it. First thing is chances of infection if you give to other patients. That is one thing. So for research purpose we can use. Otherwise not for infusing to the patients. Not even FFP or research purpose we can use. Not to infuse to the patients.
Yes, sir. For research purpose, definitely. If not for research purpose, we need blood for our practical examination, practical exercise for undergraduates, the blood grouping and all that. So, because that is trained blood, it is devoid of transfusion disease.
There is strict control of they don't go here and there.
And keeping this blood banks in the deep freezer of the refrigerators which are there in the ward or OT, so that has to be discouraged. We know it, but we don't know our ward sisters who use it. That also we have seen 1 or 2 cases. We tell them to keep it in the refrigerator, but which compartment we don't say, and sometimes they keep it in the freezer too. That needs to be monitored.
Thank you.
Yeah, ma'am, I just conclude. Thanks a lot. Thanks a lot to Dr. Zenith and Dr. K. Shankar and all the staff of KB in Medical College. This is sort of experience, no? Vitamin has a lot of research.